Stand by, Devin.
Okay. Hello, everyone. It is just about 12:32 here on Facebook Live, and as every Friday, we bring a doctor on. Our Doctor is in segment to talk about very important topics. And today, we're so happy to welcome Dr. Reece Jones from Southern Cancer Center. He's an oncologist. Dr. Jones, thanks for being with us.
Thanks for having me.
And he is joining us here on FaceTime because we're maintaining our social distance, and we appreciate your taking the time to adjust to this new technology with us. Let's start by talking about the risk that cancer patients may face when it comes to coronavirus.
You know, our cancer patients are certainly some of, if not the most immunosuppressed patients out there, and they're certainly fall into that risk category of being most susceptible to getting the disease, and also the most susceptible to having adverse outcomes from the disease. And while age certainly plays a factor in our patients, age is not as important. They're certainly on treatment that suppresses the immune system no matter how old they are.
No matter. And yes, because we've been talking about with coronavirus, particularly people that are older are even more at risk. But you're saying if you are going through something like chemotherapy, you are more at risk, even if you're, even if you're a child, really.
Correct. And a 30-year-old going through chemo may not be quite as susceptible to adverse outcomes as a 70-year-old, just because of pre-existing conditions. But I think we need to make the safe assumption that all of our patients are at high risk.
Right. Oh, great. So if you are watching us on Facebook Live, we are giving you the opportunity to talk to Dr. Jones as well. So if you would like for me to ask him a question, I've got you pulled up on Facebook Live. Go ahead and ask away. It could be about cancer and coronavirus, or it could be about cancer in general. If you just have any questions, I'm happy to pass those along to Dr. Jones. All right. So Dr. Jones, let's talk about how your practice is affected by this coronavirus. If someone feels a lump in their breast, let's say, for example, that's something that is not, they can go to the doctor, they can get this checked out because so many things have been closed down.
Yeah, certainly we're not delaying things that need to be addressed immediately. We're going to address them as we always have. We're certainly trying to limit some of the exposure for our non-emergent patients, maybe someone who's in a survivorship program, who's having follow-ups every 6 months. We may try to delay that by a month or two. Although we're now doing telemedicine, so people that are willing to do it that way, we're doing some of our routine follow-ups. But if someone feels a lump, if someone has a severe symptom that they think might be a malignancy, that needs to be checked out. We can't afford to wait 2-3 months when this thing finally ends. By then, things could be to a more advanced stage.
Right, absolutely. And let's talk about chemotherapy, because once you start chemo, you don't really like to have a lapse if you don't have to. How are you handling the chemotherapy appointments?
Well, chemotherapy is basically business as usual. We cannot afford to delay chemotherapy, potentially life-saving chemotherapy in our patients. It's just incumbent on us as medical professionals to try to limit their exposure to the outside world. And of course, it's incumbent on our patients to take care of themselves, to follow the social distancing rules, the washing hands, and all those things that are going to keep them safe as well.
Right. All right. So we're getting a few questions from our viewers, so we'll run through some of these. And this is not coronavirus related. This is just cancer related.
Sure.
Let's see. Melissa's saying, my thyroid was taken out in 2007. Should I be checked? I did have radiation.
Typically, after a thyroid cancer surgery and radiation, your biggest long-term risk is becoming hypothyroid. You don't have a functioning thyroid anymore, so you'll need to be on Synthroid replacement. So at the very least, you'll need to have your thyroid levels checked. And as a general rule, there are some guidelines in terms of thyroid ultrasounds and other things. Luckily, thyroid cancer is one of the most curable cancers that we see. So if you're that many years out from your thyroid cancer, odds are you're going to be doing well for a long period of time.
Right. A lot of people are asking questions about a coronavirus vaccine, and that's what we're hoping is being developed. Do you have any information on when a vaccine might be ready? I mean, that's kind of the million-dollar question right now.
Well, I've heard that there are actually some vaccines that have been formulated. The problem is getting them out to the public, because we can't, a vaccine that's formulated in the lab is not automatically ready to go to the public. It's got to be studied because it could have an adverse outcome. And so they're of course, trying to expedite that. I think you are going to see, vaccines may be brought to the public a little bit earlier than they normally would be because of the seriousness of this disease. And then, Also there's word that there's probably going to be another wave of this disease in the fall, and so
Oh,
trying to have
man.
a vaccine available for that. The vaccine certainly isn't going to do anything for right now, but certainly would for the future.
Right. And well, William is saying, can I still go to the doctor? My grandpa had to FaceTime the doctor because of this stuff. So, what I mean, I guess in some cases, yes, you can come to the Southern Cancer Center. Other cases, you're recommending not right now.
Sure. It depends on the situations. If it's just a routine health follow-up visit to maybe check your cholesterol, I think that we could probably maybe wait a month or two
Hmm.
and see where we are at that point. Now, if it's a serious illness, if it's getting chemotherapy for cancer, if it's someone with severe heart disease, we're gonna have to figure out a way to continue to take care of those patients.
Right. Let's see. Anthony says that he's on IVIG every 4 weeks. Will something like that be interrupted?
Um, so the answer is probably not, because if someone's on IVIG for various reasons, they're probably immunosuppressed.
Hmm.
And so I think it would be important to keep the IVIG going on an every 4 week basis. The important thing for that patient, whatever the underlying condition is to know they're immunosuppressed. Not that they would do anything different anyway, but they're fall in the same line as a cancer patient. You have to be very, very vigilant in minimizing your risk exposure.
Hmm. Okay, and as far as people are wondering, the doctor's offices are really operating in a different way, and I'm sure the Southern Cancer Center is the same way. You're not just going and just sitting in a waiting room. I mean, you're not.
No,
There's no. I bet you have people waiting in their car if they need to, but you're not going to have people in a crowded waiting room.
sure. We're distancing within the waiting room itself. We're screening with temperature checks out the door. Anybody who's febrile can't come into the clinic that day until we figure out exactly what the cause of that fever is. So we're trying to be very vigilant. Our waiting rooms are nowhere near as busy as they have been in the past, and that's a good thing.
And I have a friend who's a cancer patient, and she was telling me that she is pretty much sheltered in place. I mean, and she's in her 40s. She's really
Hmm.
not going out much. Would you recommend that at this time
That's
for
the right
people?
that's the right answer right now. Until things kind of settle down, we still haven't hit the peak of this disease yet. We're still a few weeks away, probably 2 to 3, maybe even 4 weeks away from this thing peaking.
Right.
Luckily, we're sheltered to some degree down here. The bigger cities, the bigger urban cities, have many more cases than we do. But I think just assume, that it's around, and I think come get your chemotherapy and then go home. Let other people go take care of things for you.
That's right. I mean, that's really when you need to exercise your social network of friends
Right.
and family who could help you go to the grocery store, or maybe you could have groceries delivered to your door, something like that, because you probably don't even want people going to, the grocery store and being exposed
Right.
in a place like that.
Now, I think a grocery store would be a bad place to go, and luckily, I think we're all blessed to have good friends and people, support network, people that will bring food to you, drop it off at your front door, so you're not directly in contact. And I think we're all blessed to have those friends and family that support us that way.
Right, absolutely. Okay, so we're getting a few more questions. Um, Wendy is just saying, what about going to the doctor for your monthly meds? I would imagine you'd need to call first. There may be a way they can get that prescription to you without you
Yeah, I
having
think
to come in.
I think for routine medicine, refills, I think that mainly could be done by phone.
Hmm.
But we're able to e-scribe, computer prescriptions now. So I think just for routine medicine refills, that could probably be done without having to come to the office. Obviously, it's just going to take a phone call to your provider to figure out the specifics.
Right. Okay, so Kelly was asking, let's see here, if you contract, and I don't know if you know the answer to this, if you contract coronavirus, are you immune to catching it again?
Not completely immune. Think of the coronavirus like the flu. Just
Hmm.
because you've had the flu once doesn't mean you can't get it again. Now, obviously, if you've had the coronavirus, you've recovered from it, you've built up antibodies in your system that would certainly help fight it off. So your susceptibility to it certainly goes down, but it doesn't mean that you're completely immune to getting it again.
Right. Okay, so here's another question here from Martha. She says, am I at higher risk since I had cancer in 2018 and I have two spots that the doctor is watching? So a couple of years
Anybody
ago.
with Right. Anybody with a history of cancer, 2 years ago, there's if you got chemotherapy or have had cancer that recently, there certainly could still be some immunosuppressant effect from your previous treatment or your previous disease. So now I would tell that person, if they had never had cancer before, though, to practice the same techniques that we're telling everybody else to practice. So yeah, I think it's good to have respect for this disease, but not overt fear of this disease, it leads to panic that leads to completely unproductive activities.
Right. I mean, for cancer patients, I mean, they have enough anxiety. So this has just kind of
Right,
placed another burden of anxiety on them.
right.
Just worry that I can't imagine how difficult that is for them right now. I'm sure you're hearing a lot of that from your patients.
Sure, they're already going through such physical and emotional stress, and this just adds a layer to that. I
Hmm.
think the thing to do though is and I think knowledge is key. Knowledge gets rid of fear. Learn about the disease yourself, learn about what to do
Hmm.
to help. And then it's incumbent on us as medical professionals to keep you as healthy as we possibly can to minimize your risk of exposure and minimize your risk of adverse events.
Right. Okay. So, what precautions, Danita is saying, should we take at the hospital while getting the infusions? Are people wearing masks while they're getting chemotherapy?
It depends on the situation. Now, in our clinic, no. Obviously, if any of our workers are sick, they're not coming in, which
Right.
luckily that happened as of yet. So, just a routine chemotherapy is not wearing a mask. It's really not in the guidelines to do so. People that are getting treatment in the hospital, there again, there's no strict guidelines for mask wearing unless you're symptomatic, and then that's certainly something that needs to be done.
Right. Now, Joanna's saying that she's a patient of Southern Cancer. You're doing a great job. She says she normally fills out a form with symptoms that she's experiencing. She says as of 2 weeks ago, she hasn't been given the form or asked about symptoms. So
Yeah,
maybe
we're trying to minimize,
forms,
things that
probably.
we're giving the patients.
Yeah.
This virus lives on various substances for various amounts of time.
Hmm.
So, try not to use pens and paper and things like that that would potentially be a mode of spread of the disease. Obviously, the way we're practicing medicine now is different than we ever have before.
Hmm.
Trying to do visits over the phone becomes somewhat challenging, but I
Right.
still feel like we can take care of our patients adequately in that way.
Right. And that makes sense with what you were just saying, that perhaps the form that she's used to filling out, now the nurse or doctor is asking her those questions so that nobody has to touch anybody else's forms or pens or anything like that. It's just another,
Right.
like you said, another layer of protection.
Yeah, direct contact, is one of the biggest ways this virus spreads. Is actually probably the biggest way.
Hmm.
Going from one surface to the other. So anything we can do to minimize contact is the best way to do it. No, obviously there's still some times when we have to touch the patient to do physical exam and various things, but making sure we've washed our hands and been vigilant in terms of protecting our patients.
Now, this person is asking, Danita asked about precautions being taken during visits to the hospital. She mentioned her child has receives IVIG and Remicade infusions. So is there
Hmm.
something that she should know about that before she goes back for her next one with her son?
No, same thing applies. Someone getting Remicade and IVIG is certainly immunosuppressed and just needs to be very vigilant. Um, and a lot of people feel more comfortable with that person wearing a mask going into an institution like a hospital.
Hmm.
Obviously the N95 masks are the only ones we know with 100% certainty
Right.
protect from the spread of the virus. But the other masks certainly at least provide some kind of barrier, and if nothing else, a comfort level for the patient. So while it's not universally advocated that people wear masks in a situation like that, it would certainly be understandable.
Right. And Ashley's saying her son is 2. He's been diagnosed with chronic asthma. Is he at high risk for getting coronavirus?
Yeah, certainly anybody with asthma, whether they're 2 or 80, is certainly at increased risk
Hmm.
because of any underlying disease process, lung disease, heart disease, whatever that might be. So a 2-year-old with asthma would certainly fall into that higher risk category, not based on age, but just based on pre-existing condition. And obviously the mother in that situation just needs to be very vigilant, washing her hands, and making sure she's protecting her child, which I
Someone
know she is.
Oh, and yeah, exactly. I know she is. So we've had a couple of folks asking about MS. I know that that's not really your area of expertise, but is someone with multiple sclerosis more at risk of contracting coronavirus?
Multiple sclerosis patients have, kind of a chronically debilitating syndrome, and certainly immunosuppression is part of that whole disease process. So certainly that would classify as a pre-existing condition that there again would put that patient at higher risk for the disease and severe complications of it.
Okay. And this person saying that she had lung surgery in 1994, and she
Mhm.
usually gets pneumonia at least once or twice a year. Am I at high risk? It sounds like yes, Linda, you are. But Dr. Jones, if you can answer that.
Yeah, I mean, pre-existing lung disease. If this patient's a previous smoker, has chronic emphysema, certainly that risk is there. But if this patient has had lung surgery before, for whatever cause, and tends to get pneumonia on a regular basis, I would certainly consider myself higher risk in that situation and be very cognizant of your surroundings and protecting yourself.
And Diane saying, what about type 1 diabetes in children?
Yeah, so adult diabetics probably are the most susceptible just because of age and other comorbid conditions. But we do know that young people with inherited type 1 diabetes are certainly at increased risk for various complications. And there again, just be very careful, very vigilant, very cognizant of what you're doing and protecting that person.
All right. Kelly says she was born with silent asthma that she grew out of, but it can cause issues if I get sick. Does that make me at high risk?
Probably not to a great degree. Silent asthma in childhood that typically dissipates over time without any chronic conditions probably does not put her at substantially increased risk. Certainly not as high as someone with bad lung disease, heart disease, cancer. But again, it's just a matter of you got to protect yourself. You got to be an advocate for yourself and protect yourself in any way you can.
Right. All right. So you have been listening to Dr. Reece Jones with Southern Cancer Center. Dr. Jones, once again, would you like to say anything to any of your patients out there or other cancer patients who might be watching in terms of the coronavirus and just kind of wrapping up and reminding them of some very important things?
Yeah, just plead with the patients. Be patient with us. We're kind of learning as we go as well with how to do this. But just know that we are our primary concern is our patients and making sure that they stay safe, making sure they stay on their treatment, but also doing that in a safe way. And so bear with us as we all transition through this time. But I would also put a plug in. Obviously we're all spending a lot more time at home with our families than we ever have before. So why don't we take advantage of that? Why don't we try to get closer to our family and it might not even be a bad idea to get closer to God during all this, and prayer certainly will.
Absolutely, absolutely. Dr. Reece Jones with Southern Cancer Center, thanks so much for being our guest today.